It's estimated 85% of people living in the United States will suffer from back pain at some point in their lives. It is the #1 leading cause of disability in this country. Tonight, a closer look at treatment options and what to consider before surgery. Junior high principal Steve Pagani prided himself on being a near-scratch golfer and a lifelong athlete until a back condition flared up last year.
A lot of pain, particularly in the arms.
David Fisher was an avid mountain biker who routinely rode the crest of Mount Tam until he found himself in a similar position.
For the first, say, 3 weeks, I simply couldn't walk.
Looks all right.
Both sought the advice of San Francisco surgeon Dr. Kenneth Light. While some of their symptoms were similar, David was treated with physical therapy and medications, while Stephen wound up having a successful but sophisticated surgery. Dr. Light says knowing the reasons behind the different treatment plans could help future back patients understand their own options.
On the average, we would like to wait at least 6 months to 2 years before recommending surgery for pain alone.
Dr. Light says most lower back pain cases resolve themselves in the first 3 months with a combination of rest and medication. But if the pain lasts for 6 months, the odds of spontaneous recovery go down to 50%. Still, Dr. Light says the decision to operate still rests on 2 key considerations.
Number 1, is the problem severe? Is the problem life-altering? Do you have difficulty getting out of bed? Do you have difficulty going to work?
Next is whether the surgeon can confidently trace the pain to a likely source using an MRI or other imaging technique. In Steve's case, a disc replacement procedure helped decompress the section of spine that was inflaming the surrounding nerves, a condition that can be caused by injuries or natural deterioration.
Between 20 and 40 years old, compression of the spinal cord or spinal nerve roots due to herniations of the disc are probably the most common.
He says for slightly older patients like David, a condition called spinal stenosis is more common. Bone spurs form on the inside of the spine, narrowing the canal, and that can aggravate the nerves when twisted. Depending on severity, treatment can involve either surgery or alternatives such as anti-inflammatory drugs.
We simply treated him with medication. In one situation, we gave him an injection, and the pain resolved.
Both Steve and David say they are now pain-free and hoping to return to the activities they love most.
I'm willing to get on the bike and give it a shot.
And a home run in my world is to just get out and play golf again. I'm about a 4 handicap when I'm playing during the summer. I can get down to about a 1. And I just want to be able to play golf and enjoy my kids.
Now, if surgery is required, there have been several recent advancements, including disc replacement, which in some cases can take the place of traditional spinal fusion, leaving the back more flexible.